It's a disease more prevalent and deadlier than most cancers combined, and yet more than 70% of Americans don't know anything about it.
And really interested in hearing how AI can help.
It's showing up and doing the work over and over again with no recognition. It just feels like you're never going to get to the end.
Day to day, you just see small, marginal, incremental movements, and many times it just stalls and doesn't go anywhere. And
there's just this moment, maybe like 9, 10 months ago, where we were all sitting in a meeting and we were looking at what we found, and we went, yeah, this is going to work.
It's a disease more prevalent and deadlier than most cancers combined, and yet more than 70% of Americans don't know anything about it. But 1 in 5 people over the age of 60 has it. It's called peripheral artery disease, and it is poor circulation in mainly the legs. And AI is getting involved to help you get diagnosed sooner rather than later, and helping in the process of bringing AI into the mix for peripheral artery disease testing. It's UC San Diego. We have a cardiologist, a vascular surgeon, and an engineering student going for her PhD that are all creating the change I think we all want to see. We're going to introduce you to Ava Fascetti. She's the engineering student. Dr. Elsie Ross, a vascular surgeon, and Dr. Mattheus Ramsis, a cardiologist from UC San Diego, in just a moment. But first, Dr. John, yes, you do know about this disease. In fact, you treat it.
Yes, just real quick. Where did we get that jingle from? I love that. You know how things like a certain ringtone will trigger memories and stuff. And every time I hear that, I'm like, oh, it's the time for the show. Did you come up with that jingle, or did anyone else?
It was
back in the day.
KDOW.
KDOW. Gotta love you. Thank you, KDOW. And thank you for giving us an extra spot on what,
Yes,
Sunday?
we do.
Fantastic.
I'm really excited. So starting
That's
very
awesome.
soon, we're going to be on KTRB as well in the San Francisco Bay Area, because we are,
Just
getting
kicking,
lots of people interested. They're giving us another time slot on one of their sister stations. So
kicking
it's going to air
butt and
twice.
taking names. Let's do it.
Yep.
Yeah, a lot of firepower on this show today. And really interested in hearing how AI can help. It seems AI is everywhere. So yeah, let's bring it in and see if we can help prevent the roughly 10% of those who have peripheral arterial disease. So over 230 million people worldwide have peripheral arterial disease. 10% can get chronic limb-threatening ischemia, which can ultimately lead to a major amputation, which is tantamount to a death sentence. So this is why, Kym, you do what you do, and this is why we do this show. So we should jump right in.
Yeah, let's get started with a moment of inspiration.
Dr. John Phillips' spectacular vascular moment of inspiration.
Okay,
Now,
kids.
when you're talking about jingles and you're talking about music, normally I would think this would be the one that would come to mind to say it's time for the show.
I've never had, or well, you can attest to this too, but anytime a guest hear that, they always have a little smirk on their face. It brings a smile several years later, I still get a smile. So anyway, just because we're going to be talking about AI, I had to ask Claude, my favorite large learning model chatbot. Like I said, hey, Claude, this is directly what I typed. Hey, Claude, can you create a quote from you about inspiration? And Claude said, here's a quote from me. So quote, inspiration isn't a spark that finds you. It's the residue of showing up day after day, even when nothing feels remarkable. Claude. So thank you, Claude. I don't know
That's
if that
actually really good.
inspires anybody or not.
I can see Ava and Dr. Ross smiling over here. That really resonates when you're trying to do something new and you're trying to create, right, this device we're going to get into. That quote, tell us, I mean, how does that quote really resonate?
Yeah, it's showing up and doing the work over and over again with no recognition or it just feels like you're never going to get to the end. Can be quite frustrating, but over the course of my career, and my career has started way before Ava's, but I know that she also feels this, is that like you eventually get to the point where you start seeing the fruits of your labor. And that's why we're excited to talk about this, because this was, an effort that we didn't know would lead to where it has led. And so it's exciting it's gotten here.
And Ava, you were smiling too, and I can see Dr. Ramsis is eager to jump in on this one. So Ava, and then Dr. Ramsis, weigh in on this quote and why it resonates.
Yeah, just jumping on the fruits of labor point. There are so many like late nights, so many meetings, so many discouraging points and graphs where we're pulling up the results and trying to talk about what they mean. How far can this really go? And there was just this moment, maybe like 9, 10 months ago, where we were all sitting in a meeting and we were looking at what we found and we went, yeah, this is going to work. And it was just everything rolled on after that. It was just very exciting.
And Dr. Ramsis.
Yeah, I'll echo everything Elsie and Ava said. And I will say day to day, you just see small marginal incremental movements. And many times it just stalls and doesn't go anywhere. And you run into barriers, both seen and unforeseen. And just to overcome them and to just have your eyes on the vision and goal and eventually getting there is something that you don't know when you start this journey. So Claude, I think hit the nail on the head.
Nice job, Dr. John.
No, it's all Claude. I just gave Claude a thumbs up, and he's pretty happy with me. So can we jump right in? Like, what are you guys talking about? How did it get started? Like, let's just go.
Bring us back. I even want to get back to even before the coffee, because I know it was a coffee between Dr. Ramsis and Dr. Ross that really, sparked this discussion. But how do you two know each other?
Elsie,
it's funny. Yeah. I mean, so we were both in the Bay Area, but didn't know each other there. Dr. Ramsis was in training still, and I had trained and then was on faculty up at Stanford and have been in AI for the longest time, but we just never interacted until we both ended up at UCSD. Dr. Ramsis for his first job, for my second faculty job, and we were both working as medical directors of informatics and had been in a meeting, and Dr. Ramsis was like, hey, let's talk. As I was trying to rush off to the next thing, but I'm glad we did have time to meet and chat. And through getting to know each other, it turns out that we actually have other connections in digital health space as well.
And so bring us to that coffee. Is this the first project you both have worked on together?
Yeah, essentially, Elsie was doing great work in AI in the Bay Area, and I was doing some work, but also doing work in digital health and specifically PPG or photoplethysmography. And at that first meeting where Elsie and I meet with the medical directors of informatics at UCSD, I gave a quick intro about this is who I am, this is the work I do, and Elsie was listening. And then the next week, Elsie gave her whole presentation of all the great work she's done. And then during that meeting, she knocked on my door and said, hey, we should talk sometime. I was like, yeah, sure, let's grab a coffee. And then we decided to have a coffee and the idea came about.
Coming up next right here on the Heart of Innovation, we're going to have Dr. Ross jump in and explain what was discussed at the coffee that led to an AI solution to P.A.D. testing. And also, I kind of want to get into how she got started in AI back in 2013. So stay with us right here on the Heart of Innovation on KDOW. Don't go away.
How many procedures are you willing to go through? Is it worth going through that many, or would you rather just step
That's funny. Was it worth it? Oh yeah, I have my leg, man.
Amputation should absolutely, positively, 100% never be a first-line treatment.
What an incredible operation, what an incredible lab you have here.
Without a doubt, we're underdiagnosing peripheral arterial disease. It has not gotten the attention that it should, because it is a killing disease, it is a disabling disease, and most importantly, it's a disease that we now have great treatments for.
Okay, let's go to the next one.
They were going to amputate it, and I needed to consult with my family. Did I want it off here or here? You're just shocked. It's scary. I don't even know how to explain it. You're 42 years old.
We're waiting till people are at the end of the spectrum and almost beyond hope. There is good care available here. Closed minds are what we have to get rid of.
Welcome back, friends. It's a wonderful Saturday, and we're having a wonderful conversation with a lot of smart people, smarter than me, who clearly are moving the needle with respect to using AI to kind of help bridge that gap between diagnosis of peripheral arterial disease. So before we went to break, we were kind of chatting about this coffee hookup. So tell me, you guys are having coffee. What kind of coffee are you drinking, by the way? Is it just regular coffee, lattes, or
It
caffeine?
had to be leaded. It
I
had to
think
be leaded.
I think Dr. Ramses bought the coffee.
Yeah,
He
yeah.
was very,
I
very nice of him.
I go straight black now.
Okay.
Yep, me too, actually.
So how long did you guys like? What was the idea here?
Yeah, so actually, I'm always curious with the cardiologists because I think they think a lot more globally, maybe sometimes than us surgeons do. We could be a bit more focused. But the reason I was interested really in Dr. Ramses's work is that he was interested, and please correct me if I'm wrong about this. This was a few years ago now, but he was interested in diagnosing diabetes using PPG signals or picking up on signals for diabetes. And it was cooler than just, I'm going to develop an app. It was research grounded in an institution, but also reaching out to people. So it was, the way they had set it up was to use, if you have Epic, you know of My Health and My Chart, send those messages to patients who could potentially be enrolled in a study, which is at a scale much larger than just waiting for patients to show up in your clinic. But either way, I thought it was really cool that they were leveraging this technology that was built into the electronic health record. And on top of that, they're using PPG signals. And he was like, yeah, we have patients put it on their fingers. And I was like, well, can we put it on the toes and
Real
do
quick,
the same thing for
can you,
P.A.D.?
for our audience, what's a PPG signal?
Yeah, Mattheus, you.
I'll let
Ava, go ahead.
Yeah, let's talk to Ava.
PPG stands for photoplasmography, which is why we call it PPG. It's too big of a word to use in all of our sentences, but basically it's just a reflection of how your blood flows through your artery. So you can look at any vascular bed on your body, like your finger or your wrist. It's how like smartwatches and smart rings do things like heart rate detection nowadays. So what we did is we took the PPG signal at the toe site and
Were you
paired
guys
that
involved
to
at all with like Medtron? There was a device called Flomet.
Oh, I remember seeing that.
With Medtronic, and we would use it. I mean, it looked like a pulse pressure analysis, basically. We put it on the toe to see what the blood flow looked like before and after. Is that similar to this or no?
Well, it's very hard to know how similar it is just because when I've tried to figure out what Flomet was doing, it was proprietary.
Oh, yeah.
I was hoping that
Yeah,
would
the
go,
PPG.
and then Medtronic bought it, and then they like it's gone, it's dead. I don't know. They couldn't monetize it, I don't think.
But Dr. Ramses, you were using it hoping to diagnose diabetes sooner. Was that the goal? And it was through a clip that went on the toe using this PPG technology?
Yeah, so I was doing it completely with software and no new hardware. And so I first got involved with PPG actually in 2018 when I was going to UCSF for fellowship. And my chief at the time pulled me into a research project in working with Samsung Research America. And we helped co-develop the AFib algorithm that they use in their watch today. And so that was my first exposure to PPG. And then through different mentors there, I got into the diabetes project. And the way they did it was before I got there, was they had this huge database of people. And based on the PPG signals they had, they developed an algorithm to detect diabetes. They didn't do it at the time against the gold standard. So my project was thinking, well, why don't we just validate it against the gold standard in a decentralized way? As people know, clinical trials, it's expensive. You have to get people on site. Transportation is an issue. So we said, well, you can get the PPG signal via any light and any end digit. And so if you have a phone, and actually any of us, you can actually download an app right now on your phone and get a PPG signal. And so we said, why don't we just send out a way for people to get the PPG signal on their phone and just validate our algorithm that way? And we were doing it. And we were doing it in a informatics, decentralized, remote, at home approach. And so I was giving this pitch to the group, and Elsie was in the audience when I was talking about this project.
And so when you were talking about this project then over coffee, how did it evolve into then using it for P.A.D.?
Yeah, so I think for me at least, and Elsie, I'd love to hear your thoughts. We were talking about, I mean, Elsie, she was talking about P.A.D. and just the physiology. And then there was a moment in the conversation where it was brought to my attention that PPG signal is obtained at the same time of which a patient gets an ABI. And then the second I knew those two were co-occurring, we both looked at each other like, wait a minute, there's probably something here. And so we then just started digging and looking and said, oh, I think we could build something. And we'll dive into this later, but not just in this black box AI approach or broad AI approach, but actually something explained in physiology.
So how did Ava, I see you nodding over there. When did you get involved? How did they rope you into this project?
Yeah,
did you know either of them beforehand? Had you worked on anything with them beforehand?
No, this was our first project together, the first of many, I hope. And Mattheus, do you remember exactly what that first connection looked like? I think you reached out looking for engineering team.
So Elsie and I were sitting there, and we were trying to come up with the team in terms of how to build this. And initially, I was going to work with people at my prior institution, but everybody was just too busy to work on it. So then it's a long story, but eventually I got to Ava's PI or senior lab director named Edward Wang. And I simply cold emailed him and said, this is who I am. This is what I'm working on. Would love to set up a time to meet. And he said, let's meet. And the funny thing is I actually missed our first meeting.
Oh, that probably went over really well.
Service?
Let's just continue this after the break.
Oh, perfect.
Going to break.
We like cliffhangers.
Yeah, this is a cliffhanger.
Your type of condition is called critical limb ischemia. It's the most advanced form of P.A.D. or peripheral arterial disease.
Every 4 minutes, there is an amputation in this country due to P.A.D. and diabetes. We also know that 85% of these amputations are preventable with early intervention.
It's a flip of the coin. Patient prognosis is tied to whether or not they are referred to a true expert in the management of peripheral arterial disease.
Do you know if your physician is an experienced CLI operator?
When you're in the hospital dealing with doctors and stuff, you figure they know what they're talking about.
The skill level varies doctor from doctor and hospital to hospital.
Patients with limb threat are in constant fear. The depression that someone experiences after they lose a limb is equivalent to those of losing their spouse of 40 years.
I was stuck in a wheelchair close to 2 years and my husband had to quit work.
I didn't know what to do at this point because we had nothing but infections and hospital stays and infections and hospital stays.
And they took one toe, another toe, and then it was another toe, and then half his foot before he was even diagnosed with P.A.D.
And all I heard was, what are we doing here? Just cut it off. And I pulled the curtain back like, are you kidding me?
Do you really want to go through all that?
That's crazy. That's insane.
The protocol is to send them to amputation. Always, always, always get multiple opinions.
We do have options.
We need to listen more to our patients.
If you're going to chop off their leg anyway, why not just let someone else try?
This is the progression. First comes the wounds, and then comes an amputation. And I wasn't going to accept that.
So that's what it's like to try to save a leg.
Welcome back, everybody. Thanks for joining us. So, Ava, you're a PhD student, and your lab is all things digital health. And so somehow you're going to try to dock in your kind of realm of research into what these two are proposing with these PPG signals and P.A.D., right?
Yeah, totally. So we touch all things health. I do all things engineering. I was actually trained as a general engineer. So instead of being like specific in working on circuits, which a lot of what our lab and our department focuses on, I like to kind of hear interesting problems, see, okay, what is the value in this, and see if I can learn along the way and dive in and apply what I know. So for this project, I heard the premise. My advisor pulled me in immediately and said, Ava, this sounds like something you'd be interested in, and expanding access to things like health screening through simple devices. And from there, I just got hooked and started diving in.
Yeah, so you ghosting him, Dr. Ramsis, her director, it still panned out.
All things work together.
What is the premise? What's the premise then, right?
Yeah, I would say that the premise is, so if we go back a little bit, 2013, I was really interested in AI machine learning, right? And the use case that I had in my head was like, we're not diagnosing PAD well. These patients come in to the primary care doctor, no one's checking their pulses, even then before telemedicine started. And they go on and then they end up in a vascular surgeon's office needing surgery and all these interventions and eventually sometimes amputation. So can we take data of some sort and use it to try to diagnose patients earlier? As someone who was in the health system and I was a resident at that time, I used electronic health record data. And that's a lot of the work that I was presenting during these medical director meetings when I ended up at UCSD. So we can use electronic health records and AI/machine learning to identify patients who likely have a diagnosis of PAD but have not yet been diagnosed. That was where a lot of this interest came from. And then it's like, okay, I'm thinking about it in terms of who shows up to our healthcare system. But there are all these people out there who don't have access to be able to be seen by a doctor regularly. There are consumers who might be interested in their health. And that was the unlock that Dr. Ramsis' work had really touched on, which is for people who are not always showing up, how can we help diagnose PAD earlier for those patients? And that's not going to be an ankle brachial test because that requires you to come into a lab, get a blood pressure cuff on your arm and on your leg, and then look at the ratio. That's very hard for some patients. So what if we could develop something where using an everyday device, you can get a sense of whether or not you may have this condition and then get it confirmed by your primary care or someone more specialized. So that's the whole premise of this is like, let's take the complicated stuff I was doing with the EHR records to the consumer and see if we can develop technology that can help diagnose PAD earlier.
Okay, so Ava gets involved and you're hearing their vision. Take us to the practicality of it. What did you do from there?
Yeah, well, first there was a huge lift from our fantastic medical student collaborator on this, Mustafa. He went in and collected the data from the vascular laboratories with Mattheus and Elsie's resources and just getting in there and physically extracting thousands and thousands of signals and sending them to me so I could do something with it.
And how do you know what to do with these signals? Did you have some software to analyze it? Is that where AI comes in?
Yeah, there was some coding, but first we honestly just looked at them and said, can we, just by looking at them, start to make some guesses on what we might want to look at and what we might want to give to the AI to do some solving. And that's where a lot of the expertise from our team came in, because Dr. Ross here was like instrumental. And I said, well, I'm going to show you two signals. I'm not going to tell you which one has PAD. I want you to guess and tell me why you think that one does. And I started trying to unpack the medicine and the physiology in an engineering way of how we can do that in like computation and in computers.
And so you're benchmarking this against the ABI? Is that right?
Yeah, totally. Yeah, ABI is our ground truth. Dr. Ross and Dr. Ramsis can totally talk more about that, but that was like our basis here is because we know a PAD diagnosis based off of the ABI level that was recorded in clinic at the same time that we got these signals, we're able to have a true yes/no going on with when we made predictions about the PPG signal.
Okay, so it's like a binary signal, yes or no. Is that what you're after? Okay. Kind of like like those life screenings that people get, looking for carotid disease and AAA and things like that. Okay, but you do it at home.
Yes.
Yeah, that's what I was just going to say. It's a consumer device.
Yeah.
Or the
Well, eventually.
Like taking your shoes off at the supermarket.
I think the goal is that people will be able to have some kind of FDA approved way of getting screening for PAD that they can use anywhere. It could be at your doctor's office, or it could be at home, or it could be wherever, really. This paper is kind of like the foundation of further developing this technology.
And so you're not really diagnosing. So, I mean, you could have this in, let's say, and partner with CVS clinics and have they have those blood pressure devices that you can go in and get your blood pressure measured, right? You could even go down to your fire department and they'll do a blood pressure check on you. You putting this device out there, making it a consumer device where you're not claiming diagnosis. It's just a potential indication, like a thermometer, checking for fever, right? You don't really confirm a lot of it until you go to the doctor and have a professional check on it. But this would put power in the hands of the people.
Yep. That's the goal. And I think Dr. Ramsis can talk to this more because it's initially like, hey, can you put a phone or like, some way of getting the PPG signal on your toe? But there are so many ways in the health system and throughout life that we're picking up on PPG signals that you can take the algorithm and model that we've been able to build and transfer it to some more technologies and diagnose even more, or at least be alerted about more conditions.
Coming up next, right here on the Heart of Innovation, we're going to hear more about this device, where they're at in terms of the process of maybe bringing something like this to market. It is a long journey, but we'll get a better idea of what that journey looks like next, right here on KDOW. Don't go away. Do your legs hurt when you walk? Do you feel cramping or numbness that makes you stop and rest? This could be more than just getting older. It could be peripheral artery disease, also called P.A.D. P.A.D. happens when arteries in your legs become clogged, limiting blood flow. And when blood can't flow, your health is at risk. P.A.D. affects millions worldwide. If you have diabetes, high blood pressure, high cholesterol, or if you smoke or have a history of smoking, you are at higher risk. Symptoms may include leg pain when walking, slow healing wounds, or numbness in your feet. Some people don't even notice symptoms at all until it's too late. P.A.D. is serious. It can lead to amputation, heart attack, and stroke. But the good news, P.A.D. can be treated if caught early. Talk to your doctor. Ask about a simple P.A.D. screening test. Protect your legs. Protect your life. Every step matters. Walk strong. Live long. Get screened for P.A.D. now. For more information, go to padhelp.org or call the Leg Saver hotline at 1-833-PAD-LEGS.
Welcome back, friends. Let's continue this conversation. A lot of meat on the bone, so to speak. So, Mattheus, where are you guys now with respect to the technology? Obviously, you've got to move it forward, but maybe take us to that point where you realize you were onto something, and then kind of get us up to speed to where you're at today. And then the next few minutes, we can talk about future stuff.
Yeah, well, I'll start off by saying when we knew we found something, Ava messaged me 2 separate figures. The first one being the correlation of a PPG feature with ABI, and it was very significantly correlated, which is in the paper. And then the second one was when we saw that the PPG signals just outperformed everything we do clinically. And so us as clinicians, if we put all the comorbidities, demographics, everything we think what would put patients at risk for P.A.D., PPG just beat it out of the water every time. And so I think that's when we knew we found something pretty special. And
how did you determine that?
In terms of
that it was the PPG signal. So you had additional, so you weren't just looking at previous signals. You started doing additional testing, right? You brought in some patients and
not yet. This is more like, of all the patients we had with the PPG signal, we also knew what other problems they had. We knew whether they had P.A.D. or not, and also if they had diabetes and stage renal, if they were a smoker. And so Ava looked at those factors. Like if a patient shows up to my office and they're a smoker and have coronary artery disease, what is their likelihood of having P.A.D. is the calculation a clinician has to ask, versus, hey, I'm just going to throw a PPG, like a machine that can get a PPG signal on this patient, and ask our algorithm to see if this patient has P.A.D. or not. So that's the difference. Like, am I just getting a history and trying to correlate, or am I using technology to try to figure out if this patient has P.A.D.?
Aside from then having an abnormal ABI, that's the diagnosis, right? So like you would say that person with those risk factors has an abnormal ABI. and then also they have those risk factors, and then they have an abnormal PPG signal.
Yeah.
Right. But
accurate?
we're even coming before then. Because usually, so if the typical way it works is I think this patient's high risk for P.A.D. I'm going to go send them to get an ABI. But can you in your office say, hey, this patient may be high risk. I'm going to throw on this device and look at their PPG signal. And if it says, yes, this patient likely has P.A.D., then you can confirm with the ABI.
Gotcha. So saving money potentially. ABIs are not cheap, at least in my
They are
health
not.
system.
And I think that's part of the story about, why screening broadly for PAD hasn't really reached a scientific level of, recommendation yet, especially with our larger organizations. Part of it is the only thing we have right now to screen really is getting the ABI, and what is the benefit of that ultimately for the patient. But if you can, empower people more to understand more about their health and their risk factors, then you can move the needle a bit more without the expense.
Presumably some of them are asymptomatic, right?
Right.
But
Right.
so regardless of whether you have symptoms, if you have PAD, we've got to be really aggressive with reducing
Yes.
your risk factor for cardiovascular.
Exactly.
Okay. So that'll help. That's actually a feather in the cap too, to be very aggressive with risk factor reduction, at least in my opinion.
Right. Oh, 100%.
So what do we do
Okay.
with all this knowledge? What are
I'm jiving now. I get this. I get this. I get this.
what do we do with this knowledge that you've gained?
Yeah, as Elsie mentioned, this is just the foundation of all the future directions we can go here. And so what we could do going forward is almost the sky's the limit. So whether it's embedded into workflows of actually detecting for PAD in just the standard intake of a patient in clinic. So just as you take blood pressure, vital signs, you can do a quick assessment of the vascular health. Whether it's a CVS or some other place that you can actually take blood pressure measurements, you just get an assessment for PAD there.
Yeah,
Or
maybe someone can just pick it up like they can pick up a thermometer or an oximeter.
Mhm.
yeah,
And if they know they have these risk factors, well, pick one up and test yourself every once in a while.
And
Yeah.
even the powerful thing about PPG signals is you can take them on a smartphone. So you don't even need to get a special device. You can just download the app on your smartphone and take off your shoe, tap your phone onto the button, and do the reading at home.
Is
What
it
did they do? They put their phone up to the toe or something?
Remember, we're taking that PPG signal at the toe site. So the way that the smartphone can capture the signal is just through the camera. So you just need to put the tip of your toe on the camera for a couple seconds. We use a 4-second signal, and then our algorithm can just run on that. This is all future work. We haven't pushed out the app yet, but this is the vision of where we think it could go.
Yeah, just as Ava mentioned, we see it almost similar to like watches now for atrial fibrillation. This is essentially the smartwatch or smart remote device for PAD.
And as an interventionalist, I think about it as, is it sensitive or I guess specific enough to assess for a change pre and post procedure, or something that puts that patient in jeopardy for, I mean, I look at it like these grafts, right? In a bypass graft, can you assess flow in those or no? Is that possible?
That hasn't been tested yet, but I think what you're asking is, yes, if it's sensitive enough to pick up a change in perfusion, and that's like another future testing angle that we'd love to get into.
That is so
So can I
incredibly
ask another
fantastic.
question?
Yeah,
I'm a
of
nerd here.
course.
So Ava,
I'll
like
hold mine for next.
from your standpoint, like how long does it take to get to where you got? Like I guess all of you, how long is this going to take? Like what does this process look like? The timeline and milestones and things.
Yeah, I can jump in there. I think a lot of the hard work on the algorithm and the model side has already been done with this paper. We needed to set up the pipeline and the data processing and the AI algorithm to be able to get a signal and do this work. Now where the hard part comes in is all the wrangling of resources to be able to execute those studies, which, that's timeless. Dr. Ramsis and Ross have much more of a better idea of how long that might take. But the
Well, we're gonna
engineering
hear that.
bulk of it is clean now.
Well, we're going to hear from Dr. Ross and Dr. Ramsis on just how tedious a process is and how long it's going to take next in the final few moments of the Heart of Innovation on KDOW. Don't go away.
When your sugar runs high, it's more than a sign. Diabetes creeping in, it's a dangerous line. Pre-diabetes too, don't think it's too light. It can lead to PAD, so start the fight. Sugar's sweet, but the cost is real. High blood sugar makes your arteries feel clogged. Slow flow, it's a ticking time bomb. Catch it early, stay strong, and keep your legs on. Sugar's not so sweet when your leg is in pain. Not controlling sugar is where peripheral artery disease sets in. Got sugar? Get checked. Don't wait too late. Save your legs, save your life. Take control of your fate. Leg pain, cold feet, neuropathy too. These are signs diabetes caught you. High sugar's the link where circulation and pain. Left untreated, your leg might end in flame.
All right, guys, let's jump back into it real quick. So we've got a question from Jessica in the audience. I'm going to read the question and then ask you all to respond to it. Given that PPG waveforms can be influenced by factors such as vascular tone, temperature, blood pressure, hormones, etc., and maybe having some false positives for P.A.D., how do you guys control that in your model?
Well, I think this is systemically, yeah, right? This is why we're not diagnosing with this yet, right? So what we're doing right now, of course, there's going to be some amount of error, both false positives or false negatives, right? But what we're really trying to do is be more intentional about who we're sending to ABI screenings. So if you do have a signal that looks like you have PAD, but you don't have PAD for all of these different reasons, right? The ABI test will then reveal that later in the workflow.
Yeah, and seeing a clinician too to help give you more context on why your signals might be totally off, but you might not have the disease, I think is also helpful. Because I do think, as Jessica brought up, there are a lot of different variables that can affect it. This will also go into thinking about how we validate this going forward and who we can say we can use this screening tool for and who we can't.
Yeah, and so where are we in terms of this tedious journey? How long before I can get this app?
She wants it now, folks.
I
She wants to be a
do.
tester. Let her beta test it.
I would love to give it out to all of our patients. We have 13,000 in our network. They're ready for it.
Yeah, it's a great question. I will say this, we are in the prospective validation phase. And so how long that actually takes, I think is tough to tell. It's influenced by a variety of factors. But long story short, I mean, as Ava mentioned, the technical part of this, the heavy lifting, is done. But now just more, how do we prospectively validate it to where we can actually deploy it and find patients who are at risk and who have barriers to ABIs, but also be conscientious of healthcare utilization and resources. And so in the near future is the best answer I can give.
Yeah, I mean, I think the great thing about working on this multidisciplinary team is that we each have our access and thoughts and abilities to move this forward. Like Ava's team is really great at the engineering. They have apps that attack other or address other medical issues, so that expertise can be used to build up this technology. And then it's like getting and deciding like how far we have to go to be able to get it into people's hands. Like it's probably going to involve an FDA clearance process that with AI and more software-based technologies isn't as long as, say, like a new device. So it could be years away, not decades.
And I love the collaboration. Do people think you guys are unicorns that actually vascular surgeons and cardiologists can work together? I mean, good Lord.
We're proving that we can work together.
This is awesome. See, everybody listening, we can work with vascular surgeons. Vascular surgeons, you work with us, right? This is a team effort. There's plenty of people out there. Sorry, soapbox.
Exactly.
I love it.
No,
that must be said. But in terms of this, you can actually, I'm in Silicon Valley, and I worked at Forbes magazine and covered technology. You can find a way to get this approved as a consumer app with the right messaging and do the beta testing and then go for FDA clearance when you're ready and you've proven it and you want to actually diagnose in a sense, like the AFib.
Yeah, that's a great point. I think because we're in the university setting, we're just so risk averse, but there are lots of opportunities to get this out there earlier.
Yep,
help
big
people.
disclaimers, big disclaimers.
Yep,
Well, we're going to
yep.
keep us so up to date as to what's going on, where you're at in this journey. We're going to continue to follow you and come on the show. Open invitation for next steps. And if people want more and want to follow us, youtube.com/the @ the way to my heart. Good luck to you all. And thank you for all you do to help us save life and limb.